Welcome everybody to tonight's Fertility Ontario webinar. My name's Andrew and I'll be your host this evening. Tonight's webinar is on a new program created recently by Fertility Ontario called the Blue Sky Project. Tonight's expert is Dr. John McNaught. And I know everybody here this evening is probably really excited, curious, and wanting to get more information on this program. Just before bringing John on the call, I'll let you know a little bit about who Dr. McNaught is. And I'm sure a lot of you have been here in the past and you know who John is. But for those of you that are joining us for the first time, I'm really privileged to share a little bit more about John. John is the founder and medical director at Fertility Ontario. And maybe I'll share a little bit of the personal background. And John, you're there with us right now, right?
Absolutely.
Yeah. I don't know if it's John. Maybe did you want to maybe share what had you invite me to be on the call this evening as sort of a prelude, and then I'll better kind of create the context for the event.
Yeah, Andrew, I think this is a place that we both arrived at together. Andrew is the founder of a marketing agency called TBK Creative. TBK stands for Tagged by Kindness, which is a philanthropic effort that was Andrew's first business venture.
Yeah.
And, him and his staff have always been involved in giving back to the community. And one of their core concepts is paying it forward. And last year, Andrew was involved with us with a program called Laura's Wish, which received a lot of media attention and was a real feel-good story for us for 2012 and going into 2013. And TBK Creative actually won a national award for their work on the Laura's Wish program. And one of the things that we're going to be talking about today is what evolved out of that program and where it's brought us to. And, along with Fertility Ontario, TBK Creative has been right there with us, helping us with the marketing and awareness surrounding the Blue Sky Project. So I'm happy to have Andrew here tonight.
Yeah, thanks for having me on the call. I actually, just so everybody kind of gets a better sense of what this means to me, I was there when I actually remember the moment when I was driving to the US and John actually called me, and it was a Saturday. And he said, Andrew, you're not going to believe what happened to me yesterday. And I said, well, what happened, John? And he said, I got this package in the mail at her clinic at Fertility Ontario. And I of course said, well, what was in the package? And he said, there was 6 checks totaling, a couple $100 from people that I don't know, and these people weren't even past patients of ours. And he said, and there was a note with it that said this was a donation on behalf of a woman who recently passed away named Laura. And one of her dying wishes was, and the background I think that John learned later on that I don't think he knew at the time was, she had gone through infertility difficulties, which ended up developing a blood clot, and that doctors believed ended up leading to her death. The true silver lining of that story for her family was that she did end up giving birth previous, but the challenge was that, and her greatest wish was that other women didn't have to go through that same difficulty that she had to. And so one of her dying wishes was that a fertility clinic was chosen for a donation or to be given money so that more women could be treated and men could be treated for fertility difficulties. And so I remember that phone call. So at that time, a few months back, right before Laura's Wish, John received this check, and I said to him, or a whole bunch of checks, I said, John, what are you going to do with the money? And I remember John in a very solemn way said, I'm inclined, if a woman's going to be thinking about other people on her, at the end of her life like this, I'm inclined to pay this thing forward. And that was I think the birthing behind Laura's Wish. It was something for Laura, who really I think is the real hero in all this, and her family. And this is just a way now to pay it forward to more people. So that's what this means to me. I was on that phone call with John the day after he received that check, and it's amazing to see the demand out there of people, families that have responded to the Laura's Wish program, and now John and Fertility Ontario have, I believe, really stepped up and have created this concept called Blue Sky Project. So that's why I'm privileged to be here this evening. I want to hear more about the Blue Sky Project. I know everybody on the call wants to hear all the details on the Blue Sky Project, so you can learn how you can get involved. I should say before John dives into the information as well that if you have questions throughout, please ask them. This is an open forum. For the sake of background noise, we do have everybody on mute. Obviously, it'd be very difficult to hear anybody speak if we had everybody unmuted. But with that, we still welcome your questions. So feel free to ask questions. You can just use the chat box below. And feel free right now. How about everybody says hi? Just test it out. Say hi to John and I, and so that we know that it's working okay. And we'll type a hi back. Okay, and then so throughout, as you have questions, feel free to ask them. Hi, everybody. Yeah. Ton just came in. Hello. We got them all. We got them all. So and then if it's not a great time to ask a question, depending on where John is at with the content, we may hold some questions till the end. So I'll be monitoring them, and we'll try to get to as many questions as we can. But I know there's going to be a lot of questions on the call. And we are going to create a Q&A section at the end of the call. So I think without further ado, I think a lot of you know John's background. He is the medical director and founder of Fertility Ontario. He is. We do a lot of work with a lot of different organizations here in Canada, and there isn't many people that I know that cares more about their craft than John. It's not just a profession, but I truly know that it's a calling for John. This is a topic that he takes very seriously. And I know when it comes to the Blue Sky Project, this is something that he does see a day, and he wants to cause a day with all of you that fertility services such as in vitro fertilization can become publicly funded here in Ontario again. So I think you all are in very good hands here this evening with a true expert, an award-winning fertility doctor, and somebody that really truly cares about people creating families and having success in that area of their lives. So welcome on the call, John.
Thanks, Andrew. Okay, so I'm going to get right into it. So this is sort of the Blue Sky Project has been in effect for about 3 weeks or so, but this is the official kickoff for it. Andrew is here in a supportive role, and we rely on him to keep things running smoothly. And he has done many webinars before, so feel free to message him with any questions that you have. Like all our webinars, there's no specific medical advice discussed, and anything that is discussed is very general and not intended for any individual patient. Tonight is a little less didactic than some of our previous topics have been. It's more of a Q&A about the program and understanding how we got to where we are. And I'd like to tell you a little bit about the background of how this program evolved. More importantly, I really want people to understand why we're doing this, because the motive is every bit as important as the message. I think for people to understand the concept properly, I need to talk to you a little bit about the science behind it. And in the same breath comes the politics. And this is an area of medicine where science and politics are really either hand in hand or neck and neck, however you want to look at it. And finally, we'll get into the program itself, the Blue Sky Project, and what it could mean for people. So the Reader's Digest version is that Blue Sky is going to be available for 1 year. It's open to anybody. It's not something that you need to apply for. We are going to limit it to 2 cycles per family because we want everyone to have an opportunity to participate. Essentially, what it is a subsidized program that decreases the cost of uninsured IVF by approximately 40%. And in return for that, what we expect people to participate in is following Quebec's lead in terms of reducing risk associated with multiple pregnancy. And we'll talk a little bit more about that as the talk progresses. The how we got here is very important. Andrew alluded to the story of Laura's wish, and you know, I am happy to announce that we will be later this year completing 3 cycles of IVF for 3 families, and giving them everything that they need, including all costs and medications. And you know, the decision was made by a panel, but I personally reviewed every application to Laura's wish, and they really, you know, I was very pleased at what we were able to do. We were able to provide fertility therapy for a couple from Thunder Bay, where the husband was confined to a wheelchair. We were able to provide fertility therapy to a cancer survivor from Toronto, and as well to a couple from the Stratford area who had a dual diagnosis, a lady with severe endometriosis and a man with male factor infertility. So the panel felt that through Laura's wish that we represented a lot of the conditions that really ought to be funded under an appropriate healthcare plan. The problem with the Laura's Wish program is that at its heart, it's really not fair. You know, to have so many needing and deserving people apply for a program like that and only be able to provide help to a few, it really, it was not as satisfying an experience as we hoped it would be, because it just highlighted how much need and how much inequity there is. This photo here is of Laura's daughter, and she was born within a month of my youngest son. And every time I think of that case and how close, you know, she was in age to me, how close her children are in age to my children, it really makes me appreciate the blessings that I have in my life, and it has made me focus on sort of what I feel is truly important and the kind of doctor that I want to be and the kind of clinic that I want to run. So this project, which I think will be equally important, again, it sprung out of that really courageous and selfless act that woman made for a total stranger. We have short-term and long-term goals in the program. The short-term is in our province, in our community, in our country, we want to make a difference. We realize that there are haves and have-nots in terms of the many, many people who need fertility therapy. We want to try and bridge the gap between those who need fertility care and those that receive it. At the same time, we want to raise awareness, make people aware of the scope of the problem, and at the same time aware of the inequities involved, and understand what socially responsible fertility care truly is. Last but not least, the constant goal of the program is to help families in Ontario make healthy babies. If there's a big picture view, it's going to come in the long term, probably several months after the program has ended. We want to take the information from the Blue Sky Project and show that when we reduce costs associated with fertility therapy, people will make smarter decisions that lower the risk to both themselves and to their children. We're a small clinic. We're based in London, Ontario. We are going to see an increase in volume on the basis of Blue Sky Project, but it's going to be a small fraction of the number of IVF cycles that are done in this country and in this province. But in 1 year and in one small clinic, the changes that we're going to make are going to literally save the system millions, and we'll be able to prove that to government. So to understand why the program is being run and why there's so much controversy nationwide, you have to understand where IVF has been and where it's going. If you didn't see last month's webinar, Building Your Family Through IVF, it's available on our YouTube channel, just as this one will be. And I would encourage you to look back on it and understand how much in vitro fertilization has evolved over the years. It is no longer experimental. It is the best therapy for several types of subfertility, and it's getting better all the time. Pregnancy rates go up every year. Unfortunately, as pregnancy rates go up, the burden of multiple pregnancy rates goes up as well. So as we get better at the technique, we create more twins and a larger burden on our system overall. Twins tend to have a lot of pregnancy complications, be born preterm, and make a tremendous burden on things like special care nurseries and NICUs. So even though the system doesn't pay for them in the short term, it is paying through the nose in the long run. And all health economists agree that lowering multiple pregnancy will yield more than enough savings to pay for in vitro fertilization. I don't really see any further debate on that. The way that we reduce multiple pregnancy is to reduce the number of embryos that are transferred, because there's a direct correlation between the number of embryos transferred and the risk of multiple pregnancy. Now, we're able to do a better job with less embryos these days, and so I think people really need to start changing their expectations. There are two major advancements that are commonplace now that have provided the ability for a great pregnancy rate using less embryos, and those are blastocyst culture and cryopreservation. Now, blastocyst is essentially what we call a day 5 embryo. In the past, we used to transfer embryos after day 3 of culture in IVF. Increasingly, more and more embryos are transferred on day 5, and that's actually where the majority of my patients now get embryo transfer. The advantage is that we usually start off with a number of embryos, and our lab's ability to choose the best embryo improves based on the proportion of them that are able to culture into blastocyst. So per embryo, they have a higher implantation rate, higher clinical pregnancy rate. The ones that move on to blastocyst also have a lower rate of chromosomal abnormalities. A shockingly high proportion of perfect-looking embryos will actually be chromosomally abnormal. And that's why even when the process looks perfect on paper, we'll still end up with the absence of implantation or the absence of pregnancy. Allowing the embryo to blastulate helps to lower the rate of chromosomally normal embryos that are transferred and wasted. And the last thing that you need to know about blastocysts are that they generally freeze and thaw better than day 3 embryos. And cryopreservation is one of the keys in terms of running a successful reduction in multiple pregnancy. So cryopreservation, or freezing, is eminently safe. The comment that the question I get from all patients is, I'm freezing my embryos, is that safe? Well, these days we freeze eggs, we freeze sperm, we freeze embryos, and there are hundreds of thousands of very healthy babies born every year from this technique. it is so good now that some people have actually questioned whether fresh embryo transfer is as good as frozen. In fresh embryo transfer, there are occasionally some difficulties with the muscle and the lining of the uterus that can impair implantation. So we may yet see a day when we create the embryos in one cycle, freeze them, and then transfer them in another. And that's an area of very hot debate in our scientific community right now. The jury is still out, but it certainly reassures us that frozen embryo transfer is not only safe, but highly effective. And with newer freezing techniques, such as a process called vitrification, we see that greater than 90% of good quality embryos survive and go on to be able to be implanted. And this is, when we get into the concept of elective single embryo transfer, you'll understand how important this is. So the concept of ESET, or elective single embryo transfer, is that if you take one fresh embryo and statistically you add it to the results from one frozen or thawed embryo, and you look at the cumulative or overall pregnancy rate, the rates are identical to the pregnancy rate with double embryo transfer, but with a much smaller risk of multiple pregnancy. So the first question is, did you get pregnant, yes or no? And if you transfer one fresh and later on one frozen embryo, the answer to that question is going to be the same as if you transferred two fresh embryos. Yes, I got pregnant. The difference is that the rates of multiple pregnancy drop from about 28% to 3%. And that's really, when you look at it from a patient safety standpoint and from a health economic standpoint, why funding and regulation is so important in terms of changing the landscape across our country.
Mm-hmm.
So in terms of leadership and setting an example, Quebec deserves a tremendous amount of praise, both for their courage and their leadership. They have been fully funded since August of 2010. I was just this past weekend at a conference where Dr. Francois Bissonnette, the pioneer of this program, reviewed the first couple years of data, and he recounted his difficulties in starting the program, the political challenges he's faced, the future challenges of the program. But on the whole, everyone involved got behind the concept, gave it their all, and exceeded expectations. The government wanted a certain reduction in the level of multiple pregnancy, and the group of clinics and physicians in the province of Quebec well exceeded that expectation. They increased their use of elective single embryo transfer from 10% to 55% in women less than 35. And they saw a decrease in their multiple pregnancy rate from 28% to 5.2%. And that's based on 2011 data. And I'm drawing this from Dr. Bissonnette's presentation this past weekend in Chicago. The economic impact in a positive way to the province of Quebec will more than cover the costs of funding in vitro fertilization. More importantly, Quebec's early experience has confirmed the theory of elective single embryo transfer that we see in European models, and that's when the fresh and the frozen are combined together, the pregnancy rates are every bit as high as double embryo transfer. And that leads us to a question that was the title article of an editorial by Dr. Art Leader from the Fertility Clinic in Ottawa. Dr. Leader is a tremendous advocate for IVF funding in Ontario and throughout Canada. And his question to all of our community is, what are we waiting for? Really and truly, this is not a theory. It is practiced in several countries throughout the world. It has been proven in our own country in the province of Quebec. And just as an excerpt from his editorial, Dr. Leader says, for those who cannot afford IVF therapy and choose the less costly superovulation with IUI, the risk of multiple pregnancy is 1 in 4 and not controllable. Multiple births impact families in ways that are incalculable. The point that I've made several times is that in the province of Ontario, IUI and the use of injectable ovulation or injectable FSH is funded by the government. There's actually a huge amount of public dollars that go towards this practice. And it is a larger contributor of multiple pregnancy on an annual basis than the practice of IVF. So one of the benefits of increasing access to IVF is going to be leading people away from less effective therapies that increase their risk.
Mm.
Andrew, this might be a great time to just field a few questions.
Yeah, good time. We have a question from Kevin, John. Kevin asks, what are the ESET rates for women over 35 to 40?
Over 35 to 40?
Kevin's defined it as over 35 to 40. So I assume he means possibly over 35.
Is that in the province of Quebec or all of Ontario or all of Canada?
If you're able to type that over to us, Kevin, that would be helpful for John. Ontario.
Yeah, I don't know those on the top of my head. They're going to be similar to Canada, Kevin, in the sense they're going to be less than 15%.
Okay. Now we have a lady audience member, John, who is starting an IVF process for
Yeah, so that number for in 2011, all of Canada outside of Quebec, patients 35 to 39 was 8% ESET.
Okay. Okay.
Sorry, you were saying?
Yep. We have a lady in the audience, John, that has asked or has commented. She's starting an IVF program in a few months through a Brampton clinic. She wants to know though if she can still apply for the Blue Sky project.
Absolutely. Brampton is not one of our affiliate clinics,
Mm-hmm.
and so the pricing would not be in place. It would be up to that individual person to look at their situation and see what's best for them. I hope that regardless of the decision that they make, that they would, take heart to the spirit of the program and to the message that's being sent. So, you know, if you're someone who has a good prognosis and is at relatively high risk for multiple pregnancy, it's a good idea to reflect really carefully on the choices that you make, because not only do you impact your future and your family's future, but you're you know inadvertently or advertently you're sending a message. And there is an opportunity where you can vote with your actions. And I think fertility patients need to take every opportunity to advocate for themselves, and this would certainly be one of those.
Okay. So she could still apply if she felt that was the right decision for her.
Yeah, again, the program's open to everybody.
Yeah.
I'm certainly not trying to steal business from my colleagues, but at the same time, it's very important that we increase access to care. Um, I have the privilege of working with several very talented doctors across the province, and I can tell you that you're in good hands with just about all of them.
Mm-hmm.
Whatever decision you choose to make, I just wish you the best of success.
Yeah. Yeah. And I know you're going to give more detail on this, but Joanne asked moments ago, John, how can someone get started with the process?
Well, I think probably the best place to start would be our website, fertilityontario.com. Um, in keeping with the theme of access to care, we do accept self-referrals into our clinic. Um, we realize that one of the challenges in terms of being a fertility patient is not knowing where to turn sometimes. And we've tried to make the website as accessible as possible. People can either fill out an application for the Blue Sky project or just a self-referral to the clinic. And again, there are no criteria for the program.
Hmm.
Um, that was one of the shortcomings of the Laura's Wish program, is that we had to choose. And it's almost like saying who's worthy to be a parent. And you know what? We all are. Any person who has, enough love in their heart to give to a child deserves the opportunity to be a parent. And so we're not setting any boundaries in terms of who can participate in the program.
Great. And Tiffany just asked, can people still apply? So I think by that answer, the answer is yes. Yeah, absolutely. People can apply by going. I think the first process you're saying, John, one of the first steps could be just going to the website, fertilityontario.com. And so everybody understands too, I'm just on the site now. When you get there, if you look on the right hand side, about halfway down, you will see a link that says learn about the Blue Sky project. And there's a lot of details there.
Yeah, Andrew, if you have time, maybe you can cut and paste the link and post it for people.
Great idea. Great idea. I'll do that, John, as you move into the second half of the webinar.
Yeah. So again, we're just going to get into the project a little bit here. Um, it's open until May of actually Mother's Day 2014. We're just up and running. We are going through applications as fast as we can. It's really unlikely that we're not going to honor the conditions of the program for people who apply in a reasonable amount of time. Our staff are a little overwhelmed with the volume right now. We are doing everything we can. We do use two different IVF laboratories to try and deal with the volume. All I would ask of people is, please be patient. It's a process and evolution, and we don't want to compromise the care of one patient just to, you know, get somebody else into the program more quickly. We still want to make sure that the quality remains high. So we're going to talk about Blue Sky now. Um, I guess I should um, tell you where the name came from. Um, I was talking to a friend of mine about the challenges that I was having in terms of providing access to IVF, and we couldn't get around certain issues. It was like a logistical problem. And she said to me, she goes, "Okay, everything else is equal. You can do anything you want. The sky is blue. What do you do?" And it was actually, I later found out that there is a concept called blue sky thinking. And for me, it was sort of like a light bulb going off, where I looked at the barriers to providing access to people, and it just became a very logical way of trying to get rid of them. So blue sky is really, just reducing the cost of access. We know that the biggest barrier to care is money. Um, Geography plays a role, understanding plays a role. Um, you know, access to care, access to family doctors. But at the end of the day, the biggest burden for people is finances. Um, you know, Dr. Leader in his editorial mentioned that the cost of IVF exceeds the disposable income of most families in Canada. I think that's a great way of putting it. Um, at the end of the day, not a lot of people have $10,000 lying around the house. And so it's prohibitively expensive, and it's become in many ways a service of the elite, something that only, people with means can afford. And that really offends the spirit of Canadian medicine. I really don't believe that that's what we're about. So what we're trying to do, this is essentially like a 1-year sabbatical for me. I've just decided that for the next year, it's not really important to me to to be paid for my services. As long as there's money to pay my staff and to pay the IVF laboratories, I'm gladly going to pitch in pro bono. And that's how ardently I believe in this concept. The burden on people is immense. Ontario does fund IVF, but only about 15% of IVF cycles in Ontario qualify for government funding. The typical cost with medications will include about $10,000 per cycle, and as many people will attest, they certainly exceed that in a lot of instances. So a lot of people have asked about the Blue Sky Project, like, how are you doing that? How are you making that possible? Because it's such a huge price reduction that it doesn't seem like it is, everyone's saying, well, what's the catch? Like, what are the hidden costs? Really, there are none. We've negotiated everything that you need. So for a successful cycle, you need cycle monitoring, you need medications, you need an IVF laboratory that does a good quality job. And so prior to the launch of the program, we went out, we met with pharmaceutical companies, we met with IVF laboratories, and of course the monitoring is provided through my own clinic, Fertility Ontario. And we made sure that before we launched the program, that we were getting patients the best possible price. And then the final thing that we did to make sure that it was as accessible as possible is, wherever possible, physician fees have been waived. And that consists of me doing the work pro bono, and where I'm not able to do the work myself, we're paying other physicians to do it, and really trying to engage them in the process. The program, we feel, offers something for everybody. As you'll read about in our ebook, there are 3 tiers, and people have asked, well, why is that? And that's because IVF treatment is very unique to individual patients. The thing that changes most often is the amount of medication that you need. Things that will change the amount of medication that you need will be your age, your body weight, your underlying diagnosis, and your prognosis. So the basic package, which is all that most people will need, about 60% of patients will be given a basic amount of medication. That's $5,900 for everything that you need, including medications, and that's compared to the standard price of about $10,000. In the advanced tier, you get about 2 times the amount of the FSH injections needed over the basic package, understanding that some people will require that amount for a good outcome. And at the maximum dose, those are people who are sometimes referred to as poor responders. They're using about as much medication as the body can absorb, trying to get the best possible outcome for them. And hopefully what you can see is the program tries to be as fair as possible. As you go up in terms of the amount of medications required, the base price of the program goes down. So we're really trying to be, not to punish people who require higher amounts of medication than others. And it's really an attempt to be as equitable as possible. So I'd like to get into some of the, before we start our general Q&A, I'll go over some of the very frequently asked questions about the program. Those are my drugs covered? Do I have to transfer one embryo? Are there hidden costs? And am I lowering my chance of pregnancy? Your drugs are covered if they're covered by your drug plan. So, even though they're dispensed as part of the package, you're still going to get a total invoice for them that is eligible under your drug plan if it covers fertility medications. And that's something that you're going to need to inquire with your individual provider. So, generally the cost of medication can be anywhere from $3,000 to $5,000. So you have to know which tier you're going to require, but the cost of treatment to you overall can be less than $3,000 if your medications are covered. Do I have to transfer one embryo? Well, as I said, we're going to be doing our best to follow Quebec's example and aim for a multiple pregnancy rate between 5 to 8%. So, I'm going to try to engage the doctors from Quebec a little bit more, delve into the practices that they use to achieve such a low multiple pregnancy rate, and try to be as responsible as we can. What I can tell you is that if you're less than 35, you are unlikely to be getting more than one embryo from me. And that's because I believe that that is the medically responsible thing to do. However, there are exceptions to every rule. If you have a very poor prognosis, if you have mitigating factors, if you've failed in vitro fertilization before, we're obviously going to take that into account. So I guess, there was ever a time to say, please trust me. I'm not trying to impugn your result. I'm trying to get you the best possible result that we can. At the same time, I really want people to think about what it is to be successful. The goal at the end of the day is a healthy, live baby. And if we can reduce the risk to you, we're going to bring you further towards that goal. If you're a little bit older, typically the transfer of 2 embryos is quite feasible. It is unlikely in any situation that I'm going to transfer 3 or more embryos, because the evidence is really not there to support its effectiveness, and it does increase risk. What you should keep in mind, though, is that with excellent modern freezing techniques, every embryo that you don't transfer in a fresh situation is going to yield another opportunity down the line. So you really have to change your optics a little bit and try to redefine what it is to be successful in vitro fertilization. Are there hidden costs? They're not hidden, but it should be understood that if you need a procedure like ICSI or intracytoplasmic sperm injection, if you need laser-assisted hatching, if you need surgical sperm retrieval, the freezing itself, the use of donor sperm, the cycles where we transfer frozen embryos, that is not covered under the Blue Sky project, in the same way that it's not covered under any other pricing available through a private clinic. So those are things that you do need to be aware of. But certainly, even with the the base pricing available, you can ensure yourself of a high quality embryo transfer. And people always want to know, am I lowering my chances? Well, I think the honest answer is yes. What we need to understand as a community is that the statistics that surround this science are going to go in a very different direction. The pregnancy rate associated with embryo transfer is going to go down. There is no way that single embryo transfer in that moment can have as high a pregnancy rate as double embryo transfer. It's just statistically unlikely. And that's been shown in every jurisdiction where single embryo transfer has been imposed. But what we do know, and there are scores of data about this, the cumulative pregnancy rate, again, going back to that concept of 1 fresh plus 1 frozen, is very similar. And there's less risk to you and less risk to your baby. So, this is a challenge to people to really start rethinking things. My favorite saying is, there are lies, horrible lies, and then there are statistics. And please don't get hung up on statistics. There was a great news expose about 2 years ago on the CTV where they showed 8 different fertility clinics in Ontario all claiming to have the highest pregnancy rates. And that's pretty typical of, when we, when you talk to a doctor and you say, "Are you any good at your job?" Everyone always says, "Yeah, I'm the best." And if you polled all of us, we would all say we're the best. I think it's time to start rethinking what that means, and really choosing for yourself what you want a successful pregnancy to be. So just to sum up, and I really want to get into your questions. I'm excited to do that. Um, this project is exactly what it appears to be. There really are no hidden agendas here. It's just about lowering the cost of access, trying to be socially responsible, and advocating for change. We're going to be loud and outspoken as we go through this process. We want people to know. We want the Minister of Health to know. When we finish the project, we're going to be doing some economic analysis. But at the end of the day, all of the politicking aside, it's about you and your baby, and we want to give you the best possible outcome.
Okay. Yeah, there's lots of questions that have come in. So this is a great time now, everybody, to ask more questions, and we're going to start to field some of them here. Anything that's on your mind, feel free to ask. John, Tiffany asks, and I'm just going to read it here verbatim. Because we have had a cycle of IVF at a New York fertility clinic, could her family provide all the test results, and would that help in the application process for the Blue Sky project?
Yeah, it certainly saves me time. I get a lot of second opinions and referrals from people who have been to other clinics, and I certainly don't try to repeat anything that's already been done. So yeah, if like what we do is just get a record release from outside clinics, and if that can be done ahead of your first consultation, that really it smooths things for us. My staff is very good at that, and if you send in a self-referral form and just say that you want to do a record release from your American clinic, we can make that happen very quickly.
Okay. Um, Tonya asks, do you think the Ontario government will even consider a program like the one in Quebec? And I think what she's wondering is, you know, how close are we in this process of getting it publicly funded again?
Um, we're closer than people think. I don't want to stir anything up, but the government is actively considering this. Um, we are unlikely to get the generous package that was offered in the province of Quebec, but we've seen, as an example, in Manitoba, where a generous tax credit was offered, that's made a significant difference. There are lots of models available for both, subsidizing and funding in vitro fertilization. Um, there are some great groups in Ontario, Conceivable Dreams, IAC, who are at the table with government and are advocating on your behalf. So please support those people. Add your voice to their voices, because the more people that are heard, the better access is going to be obtained. And it's really, even if you're not a fertility patient, even if you believe in Canadian healthcare and you believe in universal access to healthcare, this is a debate that you need to lend your voice to.
Mm-hmm. What tips, John? There's obviously a lot of people on the call that this is a very passionate and important topic for. What tips or suggestions do you have for people from here to create more awareness for either the Blue Sky project or just in general getting IVF publicly funded again in Ontario? What can people do after they leave this call tonight?
Again, I really think Conceivable Dreams is a great place to start.
Okay.
They're doing a great job. They really are making their voices heard. They have almost 2,000 members on their site right now, and every voice counts. IAC is another group nationally that does. That's the Infertility Association, Infertility Awareness Associ yes, Infertility Awareness Association of Canada, and they've been doing a tremendous job for years. It's I think if we educate ourselves, if you understand the issues, if you can sort of get beyond the frustration and the anger and deal with it in a logical way, then you'll make a better argument. And you'll be able to give that argument to your neighbors, your coworkers, your local politicians, and it needs to be delivered in a fair, measured way so that people understand, regardless of how you feel about it, how important it can be.
Mm. Andrew on the call has I think, a general comment. First of all, he says, "I really appreciate the information that is being shared. 3 IUI cycles, multiple surgeries, and around $3,000 later, my wife and I are no further ahead as we were before. It's been hard for us balancing the risk of multiples with the IUI process, in addition to the years that have passed with no results." That was a general comment he just made.
Yeah, I think I think if you that's a to this gentleman, I don't want to use you as an example. Surgeries in fertility usually suggest a diagnosis of endometriosis, and the best therapy for endometriosis is in vitro fertilization. And if there was a process in place where your family could have accessed the best available therapy right away, then you wouldn't have been faced with so many difficult decisions. You wouldn't be leveraging risk versus outcome. Because yeah, I mean, when you're in that situation, it's very difficult not to just focus on a positive pregnancy test. And if there was better access to really good care, outcomes would be different.
And the same gentleman, Andrew, did confirm that it is endometriosis, John.
Yeah, that's what I figured.
Yeah. And best wishes to your family, Andrew. Tiffany John asks, "I'm 42 years old, and would this program be open to someone of my age?"
I'm sorry, how old?
She's 42.
Yeah, there's no age limit. Um, the From a medical standpoint, I do set limits for people in terms of whether or not I think therapy is going to be effective for them.
Mm-hmm.
I simply refuse to prescribe care that is not going to increase the chances of somebody becoming pregnant. So I don't have an age cutoff for IVF. Um, I I'm a pretty straight shooter when it comes to prognosis. And so if I don't think that the prognosis is good, then I won't recommend that somebody go through therapy. However, I can tell you at first blush at 42, I can't see any reason why you couldn't go through.
Okay, great, great. Michelle John asks, first of all, she says, "Thank you for doing this. This is amazing." Second thing that she asks is there a long wait to get into the Blue Sky Project?
The answer to that question is I don't know.
Mm-hmm.
Um, I, 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 I don't think so because I really try to keep a short waiting list. It would definitely be less than 3 months.
Okay, great. And this question has come up a couple times from different people, so I'm going to kind of amalgamate the question, John. There's a few different people that, again, and this is, I think, similar to a call at the previous, earlier on, but I think it's worth repeating because the questions are still coming in. A couple people on the call are either about to start a procedure or are currently in the middle of a procedure with a different clinic, and they are asking, um, how can they get involved with the Blue Sky Project, and is it open to them under their circumstance?
Yeah, again, the project is open to everybody. Um, it, uh, it, the idea is not to, steal cycles away from our partners. But particularly if you're somebody who, is really pushed to the limit by the financial burden of IVF, then the program is going to appeal to you.
Hmm.
Um, if you've got a good rapport with the clinic and you're getting good therapy, there's value in that too. And so it's not always about cost. What we're trying to do here is reach out to people in need. And if you see benefit, then we're not gonna let local politics get in the way of helping people.
Hmm. Anthony, um, John, first of all, says thank you for giving my wife and I hope. Um, how how can we use satellite clinics? Um, and I think I'm just going to reword it slightly, which I think is the intent. Um, he's asking, I think,
Yeah, I
how
think I
can
understand what he's asking.
yeah, you see it? Okay.
Not everybody lives close
In
to
London.
London,
Yeah.
Ontario. I only have one clinic. The we will use satellite clinics. It's just that the cost that that clinic charges you to monitor is going to be over and above what we charge you, and
Hmm.
that might mitigate the cost savings in the program. It's really kind of up to you and see what that number is. Because we're providing so many services pro bono, it's not like we can really deduct the cost from the program because it's already been whittled down to its bare bones.
Hmm.
Um, it depends on what a satellite would cost, would charge to provide monitoring services, and then you essentially take that and add it to the cost of the program.
Okay, and I think a final question here, John, from Michelle, and you might be able to read into this question a little bit better than me. She asks, "Do you have a cutoff number for the FSH levels?"
Um, some labs do. For me, it's really more about AMH. Um, that's I do AMH levels on everyone who goes through IVF with me. Um, if the age, background prognosis, the ovarian reserve testing is really poor, it's hard for me to suggest that IVF is going to be a good option for you. Um, if there's a significant male factor or if there's tubal blockage, I mean, if there's no other means of achieving pregnancy, then we'll do it. But like I also run a lot of natural fertility programs, which I think are highly efficacious in settings like that. What I would suggest is, come meet with me, let me do some, initial testing on you, and I will give you a straight answer. It's not always the answer that people want to hear, but it's honest and it's well intentioned.
Mm. In wrapping up the call, John, um, there's obviously a lot of people, men and women, on this call who are very committed deeply in starting a family. What final words would you share with them after doing what you've done for so many families and seeing so many situations over the years?
You know, I it's been said so many times that I think um, it maybe sounds a little hollow, but don't give up hope. The I think we're here because we value family. I can tell you that my family is the most important thing in the world to me, and it really and truly is the reason that I do what I do. And there are many different ways to build your family these days, and IVF is just one of them. And if it's something that you value and you need in your life, it's worth fighting for. And, there are answers available. Sometimes you just need to know where to look for them.
That's great, and it is going on the hour here, so we want to be respectful of everybody's time. What I'm going to do right now is I'm sending everybody once again, kind of in closing, a link. This link will take you directly to the subpage within Fertility Ontario's website that discusses the Blue Sky Project. There's information there. There's basically three things you can do with that subpage. You can read up more about the Blue Sky Project. You can also actually download a free ebook. I've read it myself. It's very informative. It's about 25 pages in length. It's free to download, and it was written by Dr. McNaught. And then on that page as well, many of you have mentioned that you do want to apply to become part of the project. There is an application form as well on that subpage, so that is a place where you can go to apply. If you have, John, if anybody has follow up questions, and there were some questions that have come in again in the last couple of minutes, is there an email that you can leave everybody with that they could directly get involved in?
Yeah, I prefer my Fertility Ontario email. So that's uh, how do I? Here, I'll type it for the group right now.
Great.
And that's an email that I give all my patients. I get a lot of emails in a given day. I will do my best to get back to you. I sometimes need a gentle reminder that I haven't answered your email. Just resend it, because it does fall to the bottom of my inbox sometimes.
Don't take
Um,
it personal.
yeah, yeah. Um, and then oftentimes what I will do is CC members of my team as well. I don't do this all by myself. I work with really talented doctors, nurses, and administrative staff. And one of the nice things about Fertility Ontario is that you have a team behind you, and so everyone gets involved, and we're working towards a good outcome for you.
Beautiful. On that note, thank you, John, for being here, and thank you everybody for you being here and the commitment that you have to educate yourself to make the right decisions for you and your partner and your future family. Thank you for being on the call. This was a very special call. Definitely check back in about a week's time or so. This call has been recorded and will be available on Fertility Ontario's blog, and it will also be available on Fertility Ontario's Facebook page. The Facebook URL is facebook.com/Fertility Ontario. John and Fertility Ontario are committed to leading webinars like this. We've been doing this, I think, every month since around summertime of last year, and the commitment is still there. And we're going to continue to do these webinars so that you can get all the education and information you need to make the right decisions for you and your family. So if you join us on Facebook as well, that's the first platform that we inform our community of upcoming information sessions like this. Thanks, everybody, and have a wonderful evening.
Thanks, guys.